Welcome to YogiViews, where my guest is yoga itself, through interviewing those who practice it, teach it, sell it, or simply love it. I am Antonio Sausys. Yoga has become tremendously popular in the world and in the United States in recent years, where the practice of physical yoga, the very well-known asanas, is known to make you feel and look good. But when applied to aid the therapeutic process of different conditions, then yoga becomes yoga therapy, a modern version of the ancient yoga chikitsa and a cousin of Ayurveda. Despite the fact that this adaptation of yoga has been effective for thousands of years, our modern social organizational style expects to have defined standards to understand what course can accredit someone as a yoga therapist. The International Association of Yoga Therapists, an organization based in the United States and mostly comprised of American individuals and schools, has been making solid efforts to come up with educational standards. To speak about this important topic, I invited Nicole DeAvilla to join us today. Welcome, Nicole.
Thank you for having me, Antonio.
Nicole is an Ananda Yoga Therapist with a background in sports medicine research, chiropractic physiotherapy, dance, and writing, and is also the author of a book entitled The 2-Minute Yoga Solution, Fast and Easy Stress and Back Pain Relief for Anyone at Any Time. She was one of the pioneers yoga instructors in prenatal and postpartum yoga and yoga therapy, and is currently a member of the International Association of Yoga Therapists Accreditation Committee. Nicole, I would like to ask you something personal first, which is, what was your first experience, your first contact with yoga?
My first experience was in college, and at the time I had started out as a dance major, as a science major, and got interested in dance. And one of our dance teachers had a weekend workshop, yoga for dancers. So I went to it, and it was one of those unexplainable things where I just started doing the practice every day. I never made a conscious decision to do that, and I just found myself doing it, and then of course getting curious and wanting to learn more about it.
So it was mainly through asana? That was your entry door?
Totally through asana was my main entry, yes.
And when did the other aspects come in?
Well, that was interesting. So after graduating, and I moved to the San Francisco, and for a while wasn't doing my yoga, wasn't doing the dance, and I had terrible, terrible back pain. I had radiating nerve pain down my arms, down my legs, both sides. And something told me that I needed to get back into yoga. I'd gotten on the Ananda Yoga teacher training mailing list. So when I got this flyer in the mail, back when you got flyers in the mail, I just looked at it and I just thought that I have to do this for me. So still I didn't have an idea that I'd be teaching, but I just knew it would be an intensive and I would benefit from it. Now, when I took the training, I insisted to have an interview because I was just like, maybe I don't do the yoga asanas well enough. Will I really be up to standard for this course? And the funny thing was, I was the youngest person in the class. Here I had dance training background, was very strong and flexible despite my injuries. And so the asanas were no problem, but I was blown away by the philosophy, the spiritual aspects of it, and it was just really mind-opening, heart-opening. And I think I did the best thing I could have done so first of all, I was just a little startled by it. And I thought, I'm not going to judge anything. I'm just, during the training, I'm going to try all the things they say. I'm going to experience it for myself, and then I can decide what I think about these really strange new concepts that were unfamiliar to me. It was the best thing I'd ever done.
And how did you transit into becoming a yoga therapist?
I love that question because I get asked that a lot because I train yoga therapists now as well. And basically my answer is I became a yoga therapist when that term became popular. Because as many people do argue, it's like, why do we need to say yoga therapy? Isn't all yoga therapeutic? And I had for some time you do need to have additional training if you're going to be called a yoga therapist, because you're going to be working with people with more serious conditions than the average person off the street who may has a little back stress or something mild. And so I had the additional training and had already been training yoga teachers in their advanced practices, yoga therapy. But it never occurred to me to call myself a yoga therapist till I start seeing the young whippersnappers around me calling themselves a yoga therapist. I said, well, that's the new term our culture's using. So yes, I'm one.
And what is the current definition? Because for a number of years, the International Association of Yoga Therapists was coming up with different or considering different definitions, and now it seems that what is the definition?
Well, in order to deal with everybody's different concept with it and really honor all the different styles and perspectives, because that's part of what keeps yoga true to its roots, the definition is about a page long. So rather than try to recite that, I'll give you my definition of when it becomes yoga therapy, when it crosses that line. It's, as we already said, that yoga in itself is therapeutic, but as soon as you are dealing with somebody with something that is more severe, people are coming specifically to you for a specific ailment. If you might be working with people where you're needing to interface with their medical doctor or other healthcare providers, you really need additional knowledge. And then just basic yoga teacher training, especially here in the West, gives people. And that's when it crosses the line to yoga therapy.
Mm-hmm. Yes, I like to think that you were saying before, all yoga is therapeutic.
Yes.
Just like all talking is therapeutic.
Mm-hmm.
But if you want to do psychotherapy, you better not talk to the florist in the corner. Yes. You might want to look for somebody more trained.
Absolutely.
And so perhaps the same. Now, as I was saying in the introduction, we know that yoga chikitsa and Ayurveda have been in existence for thousands of years. So how do they relate to yoga therapy? Is this name just a new name for the Western world? Is it the same disciplines, or are they different?
I wouldn't say they're different, but it is a new expression. So it's not just simply the naming, but as we go through time, we respond to our culture. And that's one of the things about yoga, is that really taught truly as you really deal with the person in front of you. It isn't about protocols and doing the exact same thing for each person. And so in that sense, we're dealing with a modern person. We're not dealing with people who lived thousands of years ago. So it takes on a new expression, but it's still very much rooted in those old traditions and texts. Now, Ayurveda is considered a sister science with yoga and yoga therapy. So a well-trained, I believe, yoga teacher, as well as especially a yoga therapist, is going to learn rudimentary concepts of Ayurveda, just as an Ayurveda practitioner is going to know basics of yoga therapy. And so sometimes we cross-refer. So an Ayurveda practitioner might say, there's a few yoga asanas I think might be helpful for you, or say your constitution you should be doing slow, gentle movements, or more warming, vigorous movements. Likewise, as a yoga teacher or yoga therapist, I should also be able to kind of sense through my training in Ayurveda also those very same kinds of things, and also know when to refer to an Ayurveda specialist, because it's like, well, you're somebody who could benefit from going a little deeper with this than what I know.
Mm-hmm. So I'm sensing, I wanted to ask you, what is the difference then between a yoga teacher and a yoga therapist? You have given us some, but what is the difference?
Yeah, so it is the additional training and focus. So it's not to say that if you have a master yoga teacher and a master yoga therapist that the yoga therapist necessarily has more training, but they've gone into a particular emphasis of really learning about disease processes, mental illness, and so forth in a deeper, more complex way. Whereas the yoga teacher, again, here sometimes it means they've gone into the asanas very deeply, but they may be well trained in that, and maybe also just some of the basic philosophy. We also have yoga teachers who are really deeply into bhakti yoga, meditation, and really going deeply with that, and having their students learn how to go deeply into those deeper traditions as well. So it's an emphasis of where you're ultimately going. There's a whole common pool where we're doing the exact same thing, and then as we go deeper, we just have our two different branches.
And how is the focus different? You just mentioned that the focus is different. So how is it different? I mean, I would assume that, of course, the yoga therapist has in mind the healing process of the individual, whereas the yoga teacher not necessarily.
Right. So ideally, I think for both yoga teachers and yoga therapists, I'll just back up one more thing in common, is that they need to be practicing themselves, developing their intuition and really developing their skills to communicate and understand and pick up little subtle cues from their student or their client. And with the yoga therapist, they need to really be aware of things like do no harm first. So if somebody comes in with a very extreme, say, disc problem or back problem, they need to know right away that a particular movement might aggravate that and really be a negative thing. And what's really different today than when I first started teaching yoga almost 30 years ago, you didn't get people coming in with these severe problems. It just would not occur to them to go to yoga. We've got some great research out there now saying that yoga helps back pain, yoga helps with depression, yoga helps with so many of our diseases that we have now, that people who are in more acute stages are coming to us now.
Yes.
And so we need to have those skills and knowledge to deal with this more acute population.
But let me ask you something, because many of the regular individuals that come to a yoga therapy session are not researchers, nor they read journals of research, but they come. So on the professional side and on the medical establishment side, I totally understand the need for validation through research. But I wonder if from a practical, everyday standpoint, do you think that the lack of success of Western medicine in healing is involved in the popularity of yoga therapy?
Absolutely. So there's news, you can get on Yahoo News and every now and then find something about yoga these days. But absolutely, because sometimes people come to me and yoga was their last hope.
Correct.
They've tried absolutely everything else. The doctors can't help them. I've even had, doctors send me somebody's like, I give up. I don't know what to do with this person. I don't understand yoga, but they'd like to come see you, have at it. So absolutely, there's some great things that Western medicine can do for us, but it's very limited, and it's not helping a lot of people who really need the help.
Yeah. And I would think, I would like to know your opinion about this, but I would think that also the fact that medicine is very compartmentalized. A dysfunctional knee is a dysfunctional knee, and that's what it is. Yoga, who's so keen on the integration of all existing things and mind, body, and spirit, understands that the knee is part of an individual who has a psyche and a spirit and a journey here on earth. Do you think that the integration that yoga brings to the table is also part of a popularity?
Yeah, absolutely. I just recently spoke to a colleague who said why she got into yoga was also because of back pain. She went to the doctors and they basically said, we'll give you painkillers and we can cure you through surgery. And she didn't like that answer. And she was also on antidepressant drugs as well. So she'd been to a lot of doctors. And she tried yoga, and she said, one of the reasons yoga worked, she said, is nobody ever asked me what was my relationship with my husband like, what's going on in my spiritual life, what's your diet like, not asking her any of these other lifestyle issues, which are so key to yoga practice, because as you know, yoga is not, the asanas are one little tip of the iceberg. It's really complete and deals with our whole lifestyle and our inner and outer world.
Now, as we differentiate yoga teachers from yoga therapists, and I have to say that I also started teaching yoga about 30 years ago, and it was just a few of us. Yeah, it was growing, but it was just a few of us. Nowadays, you find a yoga teacher under every stone, in every corner. And I believe, or since I know that we both teach in different yoga therapy trainings, it is also becoming very popular. And a lot of people who either been sick or have healed an elbow injury with yoga, they are now an elbow specialist, a yoga therapist. We know they're not specialists. We know this is not correct. So why the need for standards? Is this why?
That's absolutely one of the reasons. Because, yeah, that's a pet peeve, is that somebody just, they either cured themselves or they cured that one student through this one thing, so now they think they're an expert and can help everybody with that condition and probably everything else. And as well as with the asanas being so popular, we're also hearing, this has gotten into the news a little bit too, where people are injuring themselves in the classes. And these are the classes that are usually asana based. They're competitive. They're extreme yoga. If you really read, often they're saying, yeah, I was practicing this extreme form of yoga. I was showing off for the girls or whatever it was. They're doing high risk behaviors basically. And so the other thing that having standards for yoga therapists is also just really helping the public know, okay, if I've got an injury or I'm concerned about being injured, I'm going to know that I'll be safer going to a yoga therapist. But right now, it's the same thing. It could be that same person who's doing more extreme yoga, also calling themselves a yoga therapist. And another thing that's I find really interesting is that outside groups are asking the yoga community to create standards. So for example, the military, talk about some dysfunctional medical systems. They have so many vets returning with PTSD, musculoskeletal issues, on and on. And these are issues that have been researched, and the Army's seen the research and sees yoga is effective. It's also cost effective. But what they're saying is, we don't know who to hire.
Yep.
Anybody can call themselves a yoga therapist. If you get your act together, yoga community, we'll come in and we will start hiring credentialed or certified, whatever that ends up being, yoga therapists to come help. And we need you. The insurance companies are looking at this as well. They're seeing that yoga can be a low-cost, effective form of prevention as well as treatment for people. So from a lot of groups are saying, but until you get your act together, yoga community, we don't know who to hire, and we're going to be cautious because we're also hearing these bad stories of the people getting injured.
Yes.
So it's a really exciting time, actually, I think, in yoga therapy.
Yes. Now, I can't help but ask you, because when you go out in the world and teach, especially in countries where medicine is socialized, the idea of having something of low cost and effective and preventing is adored.
Yes.
When you try to push it into the United States medical system and health system, is not that well understood, because then people are not going to go to the hospitals, they're not going to require examinations, they're not going to spend money.
Yeah.
So how does that work here?
Yes, well, I think we're not seeing too much friction at this point in time because we aren't as organized and serving as many people as I see we will be in the future. So that's number one. But I think the model of the way yoga is starting to move into the healthcare system will hopefully enable it to move in without a lot of friction. So for example, many hospitals are finding that, well, if we have a meditation program, if we have a back care yoga program, we're going to save costs as a hospital. And as well as many doctors now are also saying, gee, I would like to give a better result to my students, and maybe they've tried some yoga and so they're interested. So if it comes in that way, it kind of can creep in and hopefully not be too much trouble, but potentially, yeah, we're stepping on some other people's turf, and so there's a very much a chance that there will be some issues in the future. Now,
you're mentioning mostly the benefits of having standards. Is there a downside to it?
Absolutely.
What is the downside?
And so I'm glad you asked. So with the standards and with what yoga is the last thing I want as a yoga therapist or as a client or student of yoga is to have protocols that are very prescriptive. because then it's just sort of using yoga techniques for physical therapy or using some yoga techniques as psychotherapy, and it's not yoga. So if somebody, as you say, comes in with the knee problem, and I feel like, okay, well, they come in and maybe insurance covering it now, but insurance wants to make sure I use XYZ protocol, but I'm looking at that person and saying, wait, this person has stability issues, this person has personal issues, and this person's not going to stand up on their own 2 feet and be strong and be able to support that knee if I don't look at all the other things that are going on in their life.
And these are not things that are in those protocols included in this moment.
Yeah. So, and there are no protocols that are considered, the standard protocol at this time, but that's the danger of standards. Mm-hmm. So, for example, the protocols that get researched, there's a tendency to say like, oh, that one was in a research study, so that's how we should take care of all back care. Mm-hmm. And so that we've really got to be careful we don't go down that road. Mm-hmm. So, and here's just something that's just an observation of mine. It'd be something fun maybe to research in the future. But I've been going to the Symposium on Yoga Research at international conferences, been happening the last several years. And my observation is when one of the presenters comes up and they're all excited and they said, we did this asana practice and we compared it to physical therapy. Our results were every bit as good as physical therapy. Isn't that wonderful? And everybody's happy. But the protocols that said, well, we did some pranayama, we did a little bit of asana, we did meditations, we discussed the yoga sutras and other lifestyle issues. And guess what? Our results were better than what we compared it to. So that's personal observation, but it totally makes sense to me. And that's where we need to really keep our focus, is keep it broad, keep it open, and really hopefully get the yoga therapist trained to not rely on protocols. I think it'll be a starting point.
Yeah. Ananda Yogi Bhavanani, who's a fantastic yoga therapist and yoga master, he coined this term yogopathy, because what he says is that we should keep yoga into the equation and not address the therapeutic process with the allopathic model where it's just what you do 3 and 4 of these for that knee, and then don't do the other one, and that's it. So this is what you're...
Well, I love Ananda, first of all, and I totally agree with him. And one of the issues we have in the yoga community actually is finding a balance with that. So there are some very good and I stress high quality trainings out there where they're taking medical professionals, so it could be doctors, nurses, physical therapists, and saying, here's yoga therapy techniques, here's the training for you so that you can add yoga therapy into your practice. And I think that's a wonderful thing. I'd love to, you go to a doctor and your blood pressure's high, instead of just saying, I'm going to write you a prescription, let's try a little breathing, see what happens here. The issue in the community is, can we call those medical professionals yoga therapists? And there are some who are saying, well, yes, they're doing yoga therapy with their patients, but both the standards committee and the current accreditation committee and many who support this say no. First and foremost, you need to be a yoga teacher. So it's not to say there's anything bad. In fact, there's everything good about those training programs. But to be a yoga therapist, you really need to be grounded in the whole breadth and fullness of yoga.
Wow. So what are some of those standards? What are we talking about? What have you guys come up with?
Yes, right. So I wasn't on the standards committee.
Yeah.
Our job is to implement them and work with the schools. But they were basically, if you look at, again, the foundational categories of what kind of training a yoga teacher should have. So they should learn about asana, pranayama, and meditation. They should learn the ancient texts that inform. They should know about the history. They should understand basic anatomy and physiology. They should, and on and on. So basically all of those categories that start from that foundation are expanded, and you go deeper with them. Another aspect of it is that they say you have to be practicing. So what they're saying is a prerequisite, and most people will say this is just like the minimum prerequisite before going into a yoga therapy training program, is to have had a 200-hour certification in yoga teacher training and to have been practicing yourself for at least 1 year. And we feel that practical aspect is very important. Another part of the standard says that is the practicum. So it's not enough to just do the book learning. So not only do you need to practice, you need, while you have mentored supervision, work with real clients and real people. So that's another aspect of the standards, is really making sure that the knowledge that they're absorbing is put into practical use with real people. And so they're experienced when they come out.
And so you're mentioning that these things have been added, but I also understand that a substantial amount of hours have been added as well. It used to be a 300-hour training for a yoga therapist. Now we went into 800 hours, right?
Well, yes and no. So there's a little history behind that, because there are schools out there who for a long time have 1,000-hour trainings, 1,200-hour trainings here in the United States, and that and more in India and other places. I was in Europe recently, and many of their yoga therapy trainings, even yoga teacher trainings, are much longer. Where that 300-hour training came from is Yoga Alliance, which, as you know, registers people who have gone through schools that have been approved who are teaching this foundational knowledge that we were talking about. And they started with 200, I think, because that was the best they could all agree on what those standards would be. And they said, well, we really expect that teachers should be continuing their education. So let's start at another 300 hours and have a 500 RYT. That's where the 300-hour came from, not from anyone really saying that that's the amount you need. But it's actually a little bit of an advertising. It's like, come to our yoga therapy, we'll give you 300 hours and you can register as an RYT 500. So it's almost, and then as soon as a few schools do that, you can see how there's going to be other schools doing it, because if your hours are lower, your program costs less. And that's, some people who don't understand really what it takes to be a yoga therapist, they're going to say, gee, I can do this one in less time, get the same money, registered RYT 500 as the person who's going to go through this longer, more expensive one. So a lot of people are just going to stop thinking right there and go with that. So it kind of took on its own momentum.
This concludes the first part of a two-part show where I'm interviewing Nicole DeAvilla. She is an Ananda Yoga Therapist with a background in sport medicine's research, chiropractic physiotherapy, dance, and writing. And she is also the author of a book entitled The 2-Minute Yoga Solution, Fast and Easy Stress and Back Pain Relief for Anyone at Any Time. She was one of the pioneer yoga instructors in prenatal, postpartum yoga and yoga therapy, and is currently a member of the International Association of Yoga Therapists Accreditation Committee. I hope you like our show today. And if you care to let me know, shoot me an email at antonio@yogiviews.com. I look forward to seeing you the next time.